York's classic rock, Q1043.
Hey, it's Ken, New York's classic rock, Q104.3. And I'm joined by Breakfast with the Beatles fan, who's also one of the greatest doctors I've ever had the luck and pleasure to come across. Because he reached out to us because he listens to Breakfast with the Beatles. Dr. Joseph Puma of Sorin Medical. And thank you so much for joining us.
Ken, thanks for having me. I'm a huge fan of you, your show, and Breakfast with the Beatles. It's really a pleasure to be here.
Sorin Medical, well, you first start off, explain where Sorin Medical came from, as you told me.
Well, about 10 or 12 years ago, I started an independent practice. I kind of felt like I wanted to do things on my own, and when I was trying to decide what to name it, because, you know, the lawyers say you have to have a name.
Right.
My daughter at the time, my older daughter, was at Notre Dame, and I was so inspired by Father Edward Saurin, a French immigrant priest that founded the Order of the Holy Name in the United States, the University of Notre Dame, and his motto was, be a force for good in this world. And really all I was setting out to do was trying to be a force for good in my little world.
And here's the difference. And you know, I've been telling you about Sorin Medical for a long time on Breakfast with the Beatles. Taking care of us as we age, going to the doctor before there's a problem. I can't tell you how important that is. When I went to my first cardiologist and found out that I had mild to moderate, like heart valve leakage, I was freaked out. And he said to me, no, it's fine. Catching it early, catching anything early, we can deal with it. It's catching it late that's a problem. And that's your message as well, right? Come in and let us take care of you.
Absolutely. The technology is so advanced. The real issue is merging the technology with the process, improving access, and I think what's most important for people, keeping the cost as low as possible. Every human being on this earth deserves quality health care.
And that's not jive. That's for real. I left my first cardiologist because he went out of network. He didn't want to deal with insurance anymore, and I couldn't afford it. When you go to Sorin Medical, you're not getting good quality, literally the best machines ever made, and you said to me, quote, it's not about money. We've all been looking for that doctor. Here he is, Dr. Joseph Puma. Tell us about the 3-minute heart scan.
Well, the Saurin heart scan is putting together the most, remember, any imaging of the body is a camera. And we have the most advanced camera in the world, the only CT scan in New York that is focused just on imaging the heart. We've formulated the best process to lower the heart rate to get the best images, and also have the best team that's dedicated, our technician and our nurses, excuse me, that's dedicated just to heart scanning. So that's what makes the Saurin heart scan unique. HeartFlow, which is a national company that makes the artificial intelligence software to analyze the images, has awarded us 11 quarters in a row the highest quality heart imaging in the United States.
I had the 3-minute heart scan, and it literally is 3 minutes. And you're getting this detailed visual. By the time I put my shirt on, you had the results.
The heart scan is basically the most advanced CT scan in the world. You come in, we literally tell you 3-minute scan, 15 minutes of your time. You get an intravenous. We give you some medicine to slow your heart rate down and to dilate your arteries. Then we inject the contrast. By the time, as you said, you're off the table with your shirt on, either myself or one of our cardiologists is sitting waiting for you to show you the actual images of your actual heart, your arteries, the pumping chamber of the heart, the entire thing. Now, the AI software takes about another 60 to 90 minutes to process, but we provide that for everyone, and we usually give you a telephone call the next day with those results, and then we combine all of that information with your lab work, your cholesterol profile, whether you have diabetes, high blood pressure, whatever medications you're on, to personalize care for you. And we can prove that people that come to have the heart scan live longer, which is why our motto is live longer.
When people say you wish you lived in simpler times, You really don't, because this is what we can do to keep ourselves healthy. You just told me a story before about watching a man walking up the street and he could barely get to the office. That's what we don't want. Don't first come in when it's tough to walk.
We have the technology now, Ken, to prevent heart attacks. And it's simple imaging. And with our imaging, everyone gets the AI software, the HeartFlow AI software plaque analysis, as well as the flow analysis. So we get more information than you can get if we brought you into the hospital to do a heart catheterization. And then based on that information, with your blood test, your cholesterol, your LDL, bad cholesterol, your A1C, which is a measure of diabetes or pre-diabetes, and other metabolic markers, inflammatory markers, we can customize for each patient a program for good health.
And going back to what he said about Sorin Medical, you open clinics and outposts in the most underserved, underprivileged areas in New York City. Brooklyn boy right here with a heart of gold, absolutely. And you really said to me, the most underserved, especially for heart disease, are the poor communities in New York City.
There's no question there's disparities in care. Our goal, as I said, is democratize healthcare. We want to get the best technology at the lowest cost, the highest quality to the people that need it most, quite honestly. And you're right, I'm a Brooklyn boy, as I know you are, and these are the neighborhoods I grew up in. And you don't see the big institutions building big medical centers in these communities. So Saurin Medical, we have offices with the highest quality physicians, cardiologists in communities throughout New York, except on Park Avenue.
As I said, I left my cardiologist because he went out of network and wanted more money. So Dr. Puma, with the highest quality technical machines, and they ain't cheap, and an absolute top-notch staff. I wouldn't use the word stole. I would say brought over. That's a kinder word, to bring the best team he had. And how expensive is it to come to Sorin Medical?
So you can just go online. We've even made it easy where if you just go on our website, if you put your insurance information in, it'll tell you if your insurance covers it, what your copay is. But I've said it before. I've said it on iHeart stations before, on the Breakfast Club. We take care of anyone who comes to see us, whether they have the ability to pay or not. So if you don't have insurance, you get the same scan that you received. If you have insurance and your insurance covers it, we'll handle all the paperwork. The key is you're either part of your community or you're not. The reality is what patients want over the 40 years I've been in practice is pretty much the same. They want to be able to connect with someone. They want to be able to sit and talk with someone. They want you to listen. They want to be able to get in touch with you. So it's really all the simple things that we're trying to meet the needs of the people that come to us. In 40 years, we have never once placed a patient in collections. We don't have a collection agency. We don't do any of those things. What we're hoping, what we're betting on, is that we'll be busy enough that it all kind of comes out in the wash.
And that's really what matters. And if you say, well, I feel fine. Here's the thing that I learned early. I feel fine. You may not realize it. Don't you want to know that you're fine? Just because you feel fine, I'm just getting older, I'm slowing down. I've heard that from so many people my age. No, I'm fine, I'm just slowing down a lot. And I'll say, you're not walking well. Nah, it's just getting old. How do you know it's just age?
Yeah, well, that's a good point. Well, I'll make two comments to that. Comment number one is to recognize that 1 in 3 heart attacks occur in someone who didn't know they had heart disease. That's the day they find out that they have heart disease or a stroke, right? So that's point number one. But point number two is the best way to play doctor is for you to be the patient and just tell us how you feel and let us be the doctor and figure it out. Is it you're just aging and it's physiologic, or is there something pathologic? Because the truth is that first appointment or that one appointment could change the course of the rest of your life.
Without a doubt. And we're in an age where we look up symptoms online and we're Googling this and that. You have no idea whether any of that is true, whether it applies. You don't know how to analyze what's going on. But if this is right here, if Sorin Medical is right here in our community, I'm talking to you, my Q104.3 listeners. You know we're a family. You know how much we love each other. And we're not some jive radio station. We're real. Please do this for you. Not for Sorin Medical. Do it for you. This man is offering you a lifeline. Just reach out and grab it. Sorin Medical, I'm in awe, and I'm so honored that to have met you, to be your patient, but also that you're a big Beatles fan and you're from Brooklyn.
I'm a huge Beatles fan. The Beatles soundtrack is part of my life, from my mom when I was a little kid humming or singing Let It Be in the kitchen while she was making dinner. Here, There, and Everywhere was my wedding song, my wife of 42 years. You know, and when I moved back to New York, in fact, because I was living in North Carolina for a time, it was funny that I was listening to the rock station when I was driving out to go see my mom with my kids. And what did I hear on the radio? Ken Dashow and Breakfast with the Beatles. And every Sunday when I drove out to New Jersey with my kids to see my mom, we'd listen to you. And it became the soundtrack of their life. And it's funny, the memories that it's given them.
It's the most unique thing about this one band. Every teenage, every generation loves their teenage bands. And it's like your first crush, what you remember. But how this one band is now on its fourth generation of fans. And that just normally doesn't happen. But what's the message? All you need is love. We get by with a little help from our friends. Say the word, love, beware of darkness. Everything is positive. Everything is about let's take care of each other. And to me, that's what Sorin Medical is. Let me take care of all my neighbors and make them healthy.
Well, Ken, I wouldn't underestimate the vehicle that brings it to us every week and that humanizes it and relates songs from the 60s to what's happening today, and gives them a real humanity and a real compassion and a real empathy. And I think that's what's kept it alive. I think it's all the amazing work that you've done, your authentic voice. It's kept the Beatles alive for another generation. It's not the second, it's like the third or fourth generation
Absolutely.
now.
So thank you very much. I do my part. But this is a lot more important, going to Sorin Medical. And thank you for sponsoring Live Breakfast with the Beatles. We're finally back at the Cutting Room, our home away from home. Steve Walters, beautiful place. If you've never been to the Cutting Room, as soon as you walk in, the chandelier is cut glass and full-size guitars, Stratocaster guitars that's 3 stories tall. The bar itself is a guitar, so you know where you're in the right place. So it's going to be Little Steven and me and Mark Rivera and Mark Ribler and Rich Pagano and John Colbert, who also Brooklyn boys, who played with John Lennon when he was 17 years old. And Dr. Puma is going to be there with Wayne Corbett, who's also a patient, right, from the Jets.
Yep, Wayne was in. We had a great time with Wayne, learned a lot, and it was really amazing. And I'm really excited to be at the Cutting Room. I've heard about it all these years. You know, you can't buy tickets to it.
Right.
You got to be invited, and I've never been invited. So
You are now.
I figured out a way to invite myself. I'm looking forward to meeting Little Steven. I'm really excited about it. Everyone at Sorin Medical is really excited, and we're really excited to work with you.
Thanks. Bring the staff. And once again, so you've heard all this, right? Are you going to reach out? Are you going to go online? Give them a web address as well.
SorinMedicalNY.com. That's SORIN medicalny.com. If you want a heart scan, as soon as the website opens, you press the first button that comes, and 3 or 4 simple pieces of information. And you can even schedule it yourself. We now have a scheduler online. So we've almost Amazoned, essentially, healthcare. But it's our goal: easy access, lowest cost possible, and highest quality available.
Knowing that, give me one good excuse not to go on their website. Thanks. Do it for yourself. Do it for your family. And just do it to take care of yourself so we can hang out and have more fun. Dr. Joseph Puma.
Ken, thanks
what
so
a
much.
pleasure. Thanks.
Appreciate it.
New York's classic rock, Q1043.